Hi, my name is Crystal Pasenka, and I'm the Center and Practice Manager here at Gastroenterology Associates and the Endoscopy Center.
Well, I'm Tim Jarris, and I've practiced gastroenterology in Hilo since 1989.
We have a very busy clinic and facility. Every single day we have a full patient load, which would make it very easy for an incoming physician to integrate their practice and services. We really consider it to be more of a boutique facility. We are the only outpatient gastroenterology facility in East Hawaii. While it may be small, it's definitely mighty. When the patients come off the elevator, they have two options. They can either be seen here in our clinic, or just right around the corner here is where they will be heading for their procedure. So when patients come in, they'll be welcomed here by our receptionist staff. They'll get checked in for their appointments, get all of their insurance and everything taken care of, and once they're completed their registration process, they'll be waiting here in our waiting area. The nurses then will come get the patients, and they'll be brought this way back here towards the nurses' station. Nurses will be screening them for their pre-procedure evaluations prior to their procedures. We are Joint Commission accredited. We have been for many, many years, and this also proves to patients that we take standards of care seriously.
Directly across the hallway is the endoscopy center. This is the recovery room now. The first bed is our IV start area and holding area, and then 3 additional recovery beds. It's really convenient because in between cases, in that 10-minute turnaround time to get the room cleaned up and set up for the next patient, I go back to the practice. I'll do some tasks in the electronic medical record, or I may see a patient for a quick routine follow-up. This is the procedure room. We have all Olympus 190 series endoscopy equipment. All of our equipment is high definition. We use capnography, of course, for all of our monitoring. We have argon plasma, coagulation, all in a compact unit here with electrocautery. We have a pretty good number of scopes for a single room. 2 standard size colonoscopes, 2 pediatric colonoscopes, and 3 upper scopes. So we're never really limited in doing the next patient because we're waiting for a scope to be reprocessed. And that's the facility. It's pretty compact. Typically in a month, we'll do about 200 to 250 procedures. And that's on a 7 to noon and 12:45 to 4 time frame.
We see a lot of patients coming in for their pre-procedure evaluations. This includes educating patients on the importance of their procedures, whether it be screening colonoscopies, upper endoscopies, or flexible sigmoidoscopies.
My first endoscopy patient is at about 7 in the morning, and we work until noon, where everybody takes a break, endoscopy until about 3, and then seeing consults and rechecks until 5 o'clock. That's a typical day. Monday, Tuesday, Thursday, Friday, Wednesday is normally a day off.
While we are a freestanding autonomous facility and practice, we also have the support of Covenant physician partners. Everything from clinical services, accounting, HR, benefits. Knowing that we have that support on a much larger level really allows us to focus on the work that we are doing here.
Among the Covenant endoscopy centers, I think we have some of the highest patient satisfaction surveys. I had a patient just yesterday that told me that she's telling all her friends they need to go and have a colonoscopy done because it's such an easy procedure.
We have a great relationship with all of our primary care providers here in the community.
I refer to Gastro Associates on a regular basis. The patients report a really good experience there, and I find that they provide exceptional care to my patients and always answer the clinical question that I'm asking.
Physicians don't understand enough about customer service, and they do at Gastroenterology. I trust them 100%. I went myself, so I recommend them 100%. Absolutely. They get all of my referrals.
There are a lot of demands. I mean, you could be busy 24/7 if you wanted to. There's plenty of work to be done in Hilo, and not enough providers.
We're an underserved community. We have a physician deficit of 50%. The physicians who work here are very dedicated to the job that they do. They understand that there are not many of us and that we do carry a lot of responsibilities.
We don't have a huge medical center here with tertiary care. So we end up doing a lot, and as a result, it really escalates and improves our quality of clinical practice. Our consultants are easily available. We work as a team here to take care of our patients who are our community.
That's where I think we really fit in well, because we are so needed. We have a ready market. We have built-in high volume number of patients that need to be seen.
What is really great about working at Gastroenterology Associates and the Endoscopy Center truly is the community here in Hilo.
Kind of a small town feel with really nice patients. And every day you hear somebody that says thank you for doing what you do. So you feel like you're making a difference in Hilo.
Went to medical school in Florida, did my residency in East LA, and out of all my medical experience, working from hospitals to free clinics to everything in between, my experience in Hilo has far exceeded anything I could ever dream of. It's been amazing being a physician here and living here in Hawaii. I moved here back in 2005, and I remember as the wheels hit the tarmac, I looked out the window and I saw this tropical environment. It had just finished raining, so everything was wet, green, and lush, and I knew this was the place for me.
I chose to open a practice in Hilo because it's a wonderful place to live. It's in Hawaii, which everybody loves, but it's still rural America. So we still get an opportunity to serve our communities, know your patients, and make a big difference.
If you're on the fence about moving to Hilo, you should definitely take in consideration your current lifestyle.
Is Hilo for every doctor? No. No, it is not.
If you like big city life, there isn't any really big city life here.
We have community theaters, we have small museums that are local museums, we have farmers markets and wonderful opportunities here.
We have the mountains, the desert, we have the ocean, we have the beaches. It's just such a variety of terrain that you can enjoy in your free time.
But if you're looking for a life that centers around family, if you're looking for outdoors, if you're looking for a clean environment, and if you're looking for a community where strangers still actually smile at each other and say hello and wait for the response, then Hilo and the Big Island of Hawaii is the place for you.
We have an amazing community, our staff, our patients, our providers, and I really feel that the work that you could do here would be so rewarding.
I think it's a fantastic opportunity where you have a dedicated, well-experienced staff. You have a community that absolutely appreciates you, and you don't have business competition because you're the only show in town. So it's a wonderful opportunity for a business-minded physician to become a part of Gastroenterology Associates.
People who are looking for a smaller town opportunity and want to practice good quality medicine and really advance their knowledge, this is a good place to be.
If you're interested in this kind of lifestyle, more of a rural lifestyle, we would love to have you come and visit and consider living on the Big Island and joining the practice.